Hi, thanks for joining. My name is Melissa. I'm a nurse here with the Villages Health, as well as a population health specialist. Today we're going to talk about winter woes. Is it a cold or the flu? So each year there are over 500 million colds in the United States. These are actually the main reason for people missing work and school days. Each flu season, however, which is November through March, 5 to 20% of Americans come down with the flu, which is between 15 million and 64 million per year. More than 200,000 flu-related hospitalizations during the season, and there are approximately 36,000 flu-related deaths. So if you look at the comparison, there's over 500 million colds, but about 15 to 64 million flu cases each year. So that's a pretty big difference. The different types of viruses. So colds, we'll look on the left first. There's more than 200 different viruses that can cause cold-like symptoms. So we have rhinoviruses, which cause about 30 to 50% of all colds. There's more than 100 distinct rhinoviruses, so those head colds that we tend to get. The coronaviruses, which we're hearing quite a bit of right now, they actually cause 10 to 15% of all colds. Only about 5 varieties infect humans. The rest are with animals. And then some other viruses, which cause 5 to 40% of all colds, are the adenoviruses, Coxsackie viruses, echoviruses, and others. So there's over 200 different types of colds that we know about. Now at the bottom there on the left, you'll see unknown cause, which we presume are viral, are about 20 to 30% of all colds that are noted. Now, on the other hand, on the right side here, the influenza viruses, the flu viruses. So you see type A, B, and C. So type A is found in many animals and humans. Type A is the most severe, and it's classified into HA and NA subtypes. Like, for example, the H1N1 that we most recently heard about. There's also type B, which is only found in humans. Those two are the most common that we hear about, but there is also a type C, which is found in humans, pigs, and dogs. These cause a very mild respiratory infection and usually do not lead to epidemics. So most commonly, it's type A and B with the flu that we hear about. Viruses are spread in different ways. So airborne droplets from an infected person that coughs, sneezes, or even talks can spread the virus. The droplets can land in the mouth or nose of those nearby, or can be inhaled into the lungs, which is how it's then spread and grows in another person. There's also something called surface contamination. Certain viruses can survive on surfaces that an infected person touches and then be passed to the next individual when they touch that spot and then touch their face, specifically their eyes, nose, or mouth. And then the spread just continues within that second person. These are actually details that we've gathered from the CDC, the Centers for Disease Control and Prevention. That's a great reference, a good resource to have on hand if you want some more information. Now, this is just showing you an example of how viruses are spread. So the first picture there, we see the lady sneezing. You can see all of the droplets going airborne in pretty much every direction. And the droplets travel very far, 5 to 6 feet even. The second one there on the bottom left, shaking hands. So if that person did not wash their hands after they coughed, sneezed, used the restroom, things like that, all of those germs, the contamination is on their hands and then transferring to your hand. Same thing with the top right. So opening a door, whatever virus and contamination is on that doorknob, when you touch it, it then transfers to you. Then the bottom right, so we have the child holding the pencil in her mouth, that who knows who else touched that pencil, and then sneezing, so into a tissue. So we have many different ways that viruses can be transmitted to others. So being aware, making sure you wash your hands, cover when you cough and sneeze, those are all very important ways to prevent transmission of certain viruses. So the period of contagion, the duration of the contagiousness of certain colds and flus. So we'll start with the left. For the cold, people are most contagious for the first 2 to 3 days of a cold. And it's usually not contagious after the first week, depending on if there is a fever or not, and what symptoms they're having. This is the basic that we see. So the first 2 or 3 days, they are contagious, but then after the week, they're not. On the other hand, on the right side with the flu, an infection is possible beginning as early as 1 day before the symptoms develop, because that virus is underlying within your body. It's growing and spreading, maybe before you have the symptoms, but you still have that inside of your system. It's also up to 7 days after becoming sick. It's contagious for 1 day before and even 7 days after becoming sick. Some people, including children and those with weakened immune systems and older adults, might be able to infect others for even a longer period of time. So if you have any of these symptoms, if you think you have the flu, just try to self-quarantine yourself to not spread the virus and spread the germs to others. Now, this is a graph that we found that shows the common symptoms of cold and flu. So the column on the left are the symptoms. The middle column is with the were hit by a truck and can't really move. A fever is rare with a cold. It is possible, but it's usually rare. But with the flu, a fever is common and it can last 3 or 4 days. Headache with a cold is rare, but can occur. But with the flu, it's pretty common. Body aches and pains and fatigue. Sometimes you can have that with a cold, but it's more common and severe even with the flu and can last a couple weeks. Stuffy nose and sneezing and sore throat are pretty common with the cold as well, but not as much with the flu. It's about 50-50 with the flu. And then chest discomfort and cough. It can be mild to moderate with the cold, but more severe with the flu. It's common with the flu and it's usually more severe. So just a good graph here, a good table that you could reference if you have any of these symptoms. It gives you a little bit better idea of what virus you may be getting. Like we said, the duration of the symptoms. So most cold symptoms usually go away within 7 to 10 days. With a cough, with either cold or flu, that usually is the last symptom to go. Now with the flu symptoms, they usually last for a week or two. So like we said, the cough and the body weakness, that can last longer. And it's important to make sure you talk to your doctor if you have any of these symptoms so they can make sure they're staying aware and can document what symptoms you're having and make sure it's not another virus or an underlying condition that's affected you. Now, there are some complications that can happen with cold and flu. So we have sinusitis and infection with the sinus cavities, as well as ear infections, because we have the canals that connect inside to our ears that can become infected, get some drainage there. Bronchitis, it can easily develop into bronchitis, which is an infection with the bronchioles within the lungs. and bacterial pneumonia. So that's with your lungs as well, with your breathing. This is usually something that requires a hospitalization and heavy antibiotics for treatment. Also can cause worsening of some chronic medical conditions that you already have, like congestive heart failure, asthma, or diabetes. If you have any of those symptoms currently, if you do get the cold or flu, those symptoms for your underlying medical conditions may become worse. Hopefully it's just temporarily and not long term. So some things that you can do to hopefully prevent from getting these. So reduce exposure to the germs. Avoid contact with those that are sick. If you know someone is ill, try not to go around them. Make sure you're washing your hands often after you sneeze, cough, use the restroom, or inadvertently come in contact with someone that is sick. Washing your hands with a soap for at least 20 seconds is the ideal and suggested amount of time from the CDC. Making sure you're getting in between your fingers, the front and backs of your hands, and even your thumb. Sanitizer is good as well, as long as it's at least 60% alcohol, but washing your hands with soap and water and that vigorous scrub that you're making all of the bubbles is always best. And also make sure you avoid touching your eyes, nose, and mouth, because those are dark, wet places, and that's where the germs love and can thrive and really grow. So some things that you can do to prepare your immune system is making sure you're eating a healthy diet. Lots of fruits, grains, and veggies are very important. So if you go into the produce section of the grocery store, you see all of the different variations of color. All of those colors provide our body with different nutrients and minerals that it really needs to stay strong. So trying to mix it up, get a good variety, getting some whole fruits, fresh veggies in it. If you can, that is going to be a very good way to help prepare your immune system and keep it strong. Another one is making sure you're staying hydrated and drinking water. Our body needs water, not only for the best immunity we can get, but also for everything else that our body contains, our skin, our eyes, our heart, our blood, everything needs water. We need to make sure we're staying hydrated. That also helps us flush any toxins that we might have come in contact with. Exercise is important as well to make sure you are staying active. The endurance exercises, previously called cardiovascular or aerobic exercises, that get your heart rate and your breathing elevated. If you can incorporate that into your daily exercise regimen, very important. Then we also have the other 3 types of exercise, so your strength, balance, and flexibility. If you can incorporate all 4 into every day with your routine, that would be ideal. Sleep is also very important, because while we sleep, that's when our body has time to basically do all the work. So when we're sleeping, our body gets to regenerate, it gets to rebuild and try to clear any toxins out that might have tried to invade our body, as well as it gives us time for our immune system to really kick in and get stronger. We know smoking and secondhand smoke can provide us with very negative health issues. So if you do smoke, Tobacco-Free Florida is a great resource that can help you try to quit. They have free lozenges, patches, and gum that they can provide you. But if you do not smoke and you're in contact with secondhand smoke, try to avoid it if possible, because that can be negative for your respiratory system, which then puts you at a higher risk for developing some other viruses and infections. And then also make sure your immunizations are up to date. Talk to your doctor and see if there are any immunizations that you are due for, and make sure you stay up to date on them. Some of them are required every year for the best immunity. So talk to your doctor, make sure you're always up to date on those, and see if you can get a printout so you can keep track of that at home as well. So we'll talk about the flu vaccines first. So everyone ages 6 months and older should receive an annual flu vaccine unless you have a health condition that prevents it. They can be given as flu shots, which is what we generally see. Also, there are some in previous years that were given as nasal sprays. They have been found to be not as effective recently, so flu shots are more prevalent and given more routinely. Now, keep in mind the vaccines do change every year, given what viruses they are expecting to be more prevalent. So you do need this shot every single year for the best coverage and to have the antibodies in your system. Once you get the flu shot, the antibodies take about 2 weeks to develop. So make sure you schedule your shot before flu season is active in the community. So once you get the shot, it's not really working as well until about 2 weeks after. That's when the antibodies are built and ready to fight. So if you are sick, you want to make sure you avoid exposing others to whatever that illness is. Try to keep your distance from others if possible. Stay home for at least 24 hours after your fever ends. So a lot of schools in the area and even workplaces do have that as a requirement. If you have a fever, you should stay home and be fever free for at least 24 hours before returning. When you sneeze or cough, make sure you cover your nose and mouth to hopefully prevent those droplets from spreading and getting on others or other surfaces. And also make sure you're washing your hands regularly. That soap and water is going to be the best thing. Scrubbing for at least 20 seconds on all parts of your hands. And then if you do have to use a tissue, make sure you dispose of them immediately. Don't stack them on the table because then those germs that are on the tissues can then become surface contamination to your table. And you should be the one throwing them away because they are your germs. So have you a trash can right there near wherever you are, whether it be in the bed or on a couch. Just get you a small trash can or a bag, and whenever you have to use a tissue, throw it right in the bag. That way you don't have to worry about any surface contamination. And lastly, make sure you're sanitizing surfaces that you do come in contact with. There are a lot of different sanitizing wipes and sprays that you can get. So make sure you're using those and sanitizing any areas that you did come in contact with, whether it be any airborne droplets that could have spread or any surface contamination that you came in contact with during the period you were ill. So some of the treatment options vary depending on what it is that you're experiencing. So we'll go over a few of those. There are some things that you can do to help yourself. So some self-care ideas that you can try. Make sure you're getting plenty of rest because again, when we are resting, that gives our body time to regenerate and rebuild. Also, make sure you're drinking plenty of fluids and staying hydrated because dehydration can occur. When you're not feeling well, you tend to just rest and lay around. So if you're not reminding yourself to stay hydrated, you can become dehydrated quickly, which then would make other symptoms arise. You do not want that. You may also need to get a humidifier or a cool mist vaporizer to help keep the airways moist and help with your breathing. And then the smoking, make sure you avoid smoking or secondhand smoke if at all possible. And other pollutants, so any airborne chemicals or irritants, so some sprays that may be around. If you do have to go out, try to get a face mask to avoid getting any of those pollutants or irritants inside of your nose or mouth that would then travel to your lungs. If you feel ill, you can talk to your doctor and see which of the over-the-counters, whether it be acetaminophen, ibuprofen, or naproxen, to help any pain or fever. But talk to your doctor and see which one they would suggest. The other thing you can do is there are some over-the-counter cold relievers and decongestants. as well as some over-the-counter saline nasal sprays that could help with some of your symptoms also. But again, it's a good idea to talk to the doctor and see if they have some specific ones that would work best for you, especially if you're on any prescription medications or if you have any underlying health conditions like high blood pressure. So some of the over-the-counter decongestants can cause your blood pressure to go up. So we want to make sure we're not taking it over-the-counter for some of your cold or flu symptoms and then cause some other problems with your health. So check with your doctor and see which over-the-counters, if any, they would suggest for you for your current symptoms. Another good idea would be to build a cold and flu toolkit. You can get a little container, you can get a tackle box, you can get just a regular shoe box even. Put some of these things inside of it should you feel ill, because we do know when we do come down with some type of virus, you don't really want to do anything. So if you have this toolkit already in place, then you don't have to worry about traveling and going out trying to find all of these items. So you can put some lozenges or some butterscotch candies, maybe to help soothe the sore throat. You want to make sure you have some tissues in there and splurge a little bit and get the good ones that have the lotion or the aloe in there, because if you have a runny nose and you're continuing to blow and wipe your nose, it can become raw. So splurge, spend those extra couple dollars for the really good tissues. Also, maybe get some cough syrup or honey that can help soothe your cough. Some disinfectant wipes and some disinfectant spray would be a great thing to have in your toolkit. That way, you know, you always have it on hand and you can make sure you're cleaning the areas that you come in contact with, as well as get some ready-made meal options. Maybe get some cans of different cans of soup. Chicken noodle soup has been proven to be beneficial for someone that has a cold. Maybe also get some frozen foods, some frozen meals. If you have a family, get enough that could feed all of them. That way you don't have to worry about cooking. You could throw it in the oven. It's already ready. And then when you're finished eating, just throw it away. The container can be thrown in the garbage. Toolkit's a great idea, just in case that you do come down with something. So these are some alternative treatments for colds that we do hear of quite a bit. You can see the green plus, those have been proven to be somewhat beneficial. The blue horizontal line may help, but then the red X, not so much. So chicken noodle soup, like we said, has been proven to be beneficial if you have a cold or virus. Vitamin C, if you are taking it regularly already, it can shorten the colds and lessen the severity of it. But if you don't take it regularly and you start after the symptoms come up, then there's no effect. Some zinc supplements have been proven to possibly reduce the duration of a cold by as much as 50%. And then at the bottom there, echinacea, there's been no effect on cold or flu prevention or treatment with taking echinacea. So when should you call the doctor? First, if you do have any of the symptoms and you've started taking your over-the-counters and doing your self-care and you're not feeling any better, you definitely should let your doctor know, because they may need to bring you in and test for any other illnesses, and you may require some further treatment from them. If you have difficulty breathing or experience some shortness of breath, if you have persistent pain or pressure in your chest or in your abdomen, persistent dizziness, some unusual confusion or the inability to arouse, as well as if you have any seizures or if you're not urinating or urinating much less, you should definitely contact your doctor. If you experience any severe muscle pain or severe weakness or unsteadiness that is unusual for you, as well as any fever or cough that improve but then return or get worse, you definitely should call the doctor so they can do an evaluation and treat further. So the question is, what antiviral medications are needed? So those people that are at a high risk for complications from the flu may need antiviral medications. If it's a virus, an antibiotic is not necessarily going to be what's needed to treat your symptoms, because that's to treat bacterial infections. So antivirals can lessen fever and flu symptoms. They can also shorten the time you're sick by about 1 day. And they can also reduce the risk of possible complications that you may experience. You would need to start an antiviral medication within 2 days of the symptom onset for it to be effective. If it's after that 2-day period, the doctor may not suggest it for you. One of the more common ones that we do here, specifically for the flu, is called Tamiflu. But again, it depends on the person and what their medical history is, if the doctor may suggest it, because it is a virus and it does take time just to work its course. Doing those self-care items and making sure you're getting plenty of rest is the most important thing you can do. Again, antibiotics will not help. Since the common cold and flu are caused by a virus, antibiotics will not help it get better. Taking an antibiotic when they're not needed can actually be harmful for you, because the bacteria that normally live inside your body are more likely then to become resistant. And then once you really do need an antibiotic, it may not be as effective to treat whatever that illness is, bacteria causing illness that you have. Antibiotics are only needed if your healthcare provider tells you that you have a bacterial infection. If it is a viral infection, an antibiotic is not needed and should not be taken, because then the effectiveness is not as good when you do need it, as well as your body could become immune to these antibiotics if taken over and over and over. I know in the office we do hear a lot of people requesting prescriptions for a Z-Pack. Well, if it's a virus, a Z-Pack is not going to do anything for you. So continuing to ask the doctor, I need a Z-Pack, I need a Z-Pack. Your body may be immune to a Z-Pack at this point, because if you're taking it over and over and over for every symptom and not letting your body get rid of whatever that virus is, Z-Packs may not work even if you do get a bacterial infection in the future. So in summary, for cold and flu, need to make sure you're doing everything you can for prevention. Take care of your body to build up your immune system and reduce your risk of getting sick. So doing all the things that we discussed, make sure you get your annual flu vaccine. Talk to your doctor to make sure there are no other vaccines that they suggest for you to keep you up to date and to keep you healthy. Make sure you wash your hands, soap and water, scrub them for at least 20 seconds, get in between your fingers, your thumbs, the front and back, scrub them. That friction is what kills the germs. So wash your hands often and try to avoid those that are sick. If you do come down with an illness, make sure you take care and listen to your body. If it says you need to rest, then rest. Try to avoid contact with other people so the virus is not spread. And then talk to your doctor about antiviral medications. See if you would be a candidate for getting one of those that may help lessen the duration of whatever the illness is that you have. I hope you got some good information from this seminar. If you have any questions, please contact the Village's Health Learning Center and we'll be happy to address those for you. Hope you have a great day.